challenges that have been that you are aware of in your capacity as Secretary of the Division of Health, Wellness, and Social Protection? What are some of the challenges that you've been faced with in Tobago, and some of the information that is coming to you?
Certainly. Well, I think I would actually like to reframe the question and answer it a little differently. I've been listening to your previous commentators, and I actually sat here and I thought about how blessed we are in Tobago to have a system that is way more integrated than what is happening in Trinidad. So let me take a little bit of time to explain how that functions. So even though the Ministry of Health is responsible for health and health policy in Trinidad and Tobago, the Tobago House of Assembly, through the Tobago House of Assembly Act, is responsible for several items under the fifth schedule of the THA Act, one of those items being health care. So the Division of Health, Wellness, and Social Protection, which is the division that I am responsible for, actually is the entity that does what the Ministry of Health does in Trinidad on the island of Tobago. And so we function as an elevated local government type of entity, but we also are the ones that manage the Tobago Regional Health Authority directly. Now, the good thing about the structure of the Division of Health, Wellness, and Social Protection is that it actually includes the Office of the County Medical Officer of Health, and it includes the Public Health Inspectorate. And of course, we provide the policy that the Tobago Regional Health Authority implements as it provides the medical services. So many of the challenges that I've heard Mr. Maraj, for example, speak about in terms of having people talk to each other and interact with each other and share data and share information, we are blessed to not have that challenge in Tobago because we all function in essence under the same singular banner, and we are able to communicate very freely, and we are able to manage the situation very freely. So at the beginning of this season of dengue, for want of a better term, the Office of the County Medical Officer of Health sent out a notice to the Tobago Regional Health Authority saying, hi, we are seeing a rise in dengue worldwide. We have seen dengue cases popping up in Trinidad. This is the case definition of dengue. So you're looking for people with fever, with vomiting, with the different symptoms, signs and symptoms of dengue. If you see that popping up in our hospital or health centers, definitely take the samples, send it to the public health lab, which is the Trinidad Public Health Lab. When we get the results, we will then activate the public health response for a positive case, which is what we've had to do because we've only had one confirmed positive case of dengue on the island for this season, and that happened this weekend when we got the report from the public health lab this weekend. So the collaboration that is required, I think, is actually we're in a way better position in Tobago because the management center is all in a singular space, and we work very closely with each other to ensure that everything works the way it should.
Some of the challenges that we've been facing in Trinidad is to get the public more, uh, well, to create a greater sense of awareness and a greater sense of personal responsibility. What are the challenges you all are facing? Personnel, the Tobagonian on the ground. Have you been able to sufficiently educate and share information and create a greater sense of awareness and have persons more acting more in a more responsible manner? What are some of those challenges you're dealing with? I mean, not just dealing with, Tobago is Tobago. It's from Crown Point to Charlottesville.
Certainly. And I think we are also blessed with having a public health department that has actually been doing quite a bit of the background work. So a couple months ago, for example, we had a school's mosquito prevention competition where we actually had the primary schools and secondary schools and even some of the preschools participate in learning about the areas around the house that can breed mosquitoes and so we've been doing that kind of education at all levels. Now, granted, we certainly need to do some more. We certainly are seeing individuals who are not necessarily following the directions and are not following the guidelines. But I think the vast majority of Tobagonians are hearing the messages. And with the case that popped up over the weekend, for example, they are becoming more in tune. So I got a call this morning from a village council representative who indicated that that village council was taking it upon themselves to do a community cleanup in their village and they were asking for support from the public health department just to get like trucks and so forth to come and pick up the stuff after they have done their cleanup. And that is the kind of response that we have been getting. Of course, our vector control, so our public health personnel have also been going around knocking on people's doors, going into people's properties, looking around for areas that can be breeding ground, and having those kinds of even one-on-one conversations in the families, in their yards, in their homes, to help them to move away from some of the practices that cause mosquitoes to be bred. So I think that we have a way to go. We still have to do some more cleaning and to get more people on board. But for the most part, I think that we are responsible individuals, and I actually would like to commend the Tobago population for that.
I don't think Tobago has some of the challenges that we have here in Trinidad. Let me put it this way: Tobago is a lot cleaner than Trinidad. When you're in Tobago, it's a different world. Sometimes when you're in Trinidad, you're seeing the place, you can see the difference in landscape. Um, what have you all been doing in terms of the Charlottesville Speyside area? Is there a difference or disparity in terms of how people respond to the threat of dengue in, if I may put it this way, in the more suburban areas as opposed to Crown Point and the more central part of Scarborough?
I have not picked that up. Probably because outside of probably the Crown Point area, almost all of Tobago is still sees itself, even though we may not necessarily be, still sees itself as relatively rural and definitely residential. So outside of Crown Point, outside of Scarborough, where we actually live is seen as more residential, as more rural, and therefore we carry those philosophies with us as we go along our day-to-day activity. So I have not gotten any reports of seeing a big difference, for example, in how these areas function compared to other areas. Of course, the challenges that affect areas like Crown Point, because we have a larger volume of people who are there, a larger volume of people who are transient. So they literally just come in for the weekend, come for the lime, come for the fete, and then go back. We do have to manage that a little bit differently compared to the areas that are more residential, that are the typical village life kind of thing. But I am not seeing, it has not been reported to me that there's any big disparity in any of those areas thus far.
We're in the midst of now the the season where we're into the Pan is More Beautiful festivals. I was checking on my phone just to make sure that I'm not misquoting. There are several Tobago bands: Metro Stars, Natural Mystic, Hope and Groovers. There's Dixieland, Alpha Pan Pioneers, NGC Steel Explosion, Cats and Jammers. Um, how has that impacted on the steel band fraternity? Uh, the outbreak. Are they still practicing? Are you aware of? It hasn't hindered in any way preparations for the Pan is More Beautiful festival that's coming up?
No, no, it has not. And remember, we only have one of the hundreds of cases that are classified in Trinidad and Tobago. Only one confirmed case is from Tobago. Now we have, there are other individuals who have the symptoms of an infection, but when you realize those symptoms are, the headache, the body, the fever, the nausea, that kind of thing, those are symptoms of, practically almost everything. So that is why we need to do the testing to ensure that they are confirmed. But for now, we only have one confirmed case of dengue. So Tobago is not feeling the kind of pressure that we are feeling, that I envision that our brothers and sisters are having in Trinidad. When we compare the numbers of cases in Trinidad versus in Tobago.
Well, I guess it's safe to say at this stage that preparations, even for the secondary schools football leagues, male and female, that's taking place as of September, it hasn't affected on those social the social part of life there. What about the tourist industry? Um, I would imagine that when you get that information in the public space, that we have a dengue outbreak, how the tourists interpret that is a different scenario altogether. Have you all begun to get any feedback or any sort of information as to how you all intend to share that message out there that, though we're in an outbreak season, that it's under control and tourists shouldn't fear, um, you know, holidaying, even for the Trinidadians that come on weekends?
Certainly. Well, the good thing is that in Tobago, we have actually been working very closely with CAFA, the Caribbean Public Health Association, and their health tourism program, where the tourism plants, so the hotels and bed and breakfast and those things, are actively engaged when it comes to health issues. And that is, of course, for as it relates to infections. COVID taught us several amazing lessons. And that also relates to food safety and water safety and so forth. So because we are already working very closely through CAFA to have a tourism health foundation where we quickly share information. The hotels also know, for example, that they can call our public health department, and we are there at the drop of a hat to provide information, to provide advice, to help them treat with whatever issue that they may have that is a health related issue. I don't envision the single case that we have being a challenge at this point. Again, because we already work so closely tourism and health to ensure that our tourism plans are as safe as possible. And because we are using that CAFA Health Tourism Health Foundation and the guidelines that were drafted for that, those are the things that we are rolling out. So I actually think that we are blessed to have survived COVID and to have learned many of the lessons that we did from COVID so that we can now implement them whenever there is any other kind of infection or any other kind of outbreak that may be happening on the island.
Like everything else, we have to think about money. Um, have you all been able to access the necessary funding to ensure that the infrastructure that you have in place and the institutional machinery is not in any way impacted? Um,
So the Tobago House of Assembly is very used to the fact that we don't get enough money. We just read our budget for 2025 in the THA House, and the normal thing is we request a couple $1 billion, we get 2 point something billion, and then we have to make do. What most people don't recognize is that, so for example, when the Division of Health, Wellness, and Social Protection gets its 700 or $800 million, quite a bit of that actually goes to the Tobago Regional Health Authority to do what they do, and the rest of it stays with the division to do what we need to do. And because all of these entities are under one umbrella, we are able to share resources. We are able to work collaboratively. We are able to cut and contride because that is what we need to do. So at this point, I think my mindset as Secretary for Health, Wellness and Social Protection, and all of the secretaries within the Tobago House of Assembly, led by our Chief Secretary, Farley Augustine, we have learned over the last 2.5 or so years that we really have to turn water into wine and turn stone into bread because we just have to use the monies that we have in the most effective and efficient manner. And that is what we have been doing in all of the divisions, including the Division of Health, Wellness, and Social Protection. So, although we will always ask for more money, we will always require more money, we have figured out how to make what we have work, and that is what we have been pushing. That is why, for example, we have the strategy includes doing quite a bit of the preventative stuff. That is why it includes having our perifocal workers going around and doing the house inspections, because that is part of their daily function to ensure that we don't have to react to a huge outbreak. That is why, for example, when Ho and Kafra, and they had a training a couple weeks ago. They actually had the training as relates to insect vector resistance and so forth. That training actually happened in Tobago, and quite a number of our perifocal workers were part of that week-long training to ensure that we are prepared for things like this coming up. So yes, we always need more money. Yes, we are underfunded as every other entity, but we are figuring out how to make it work, because as an island, we simply have to do that or we will not survive.
Tell us something. How has uh, your ministry, in collaboration, or is there a collaboration between your ministry and some of the stakeholders in Tobago, such as the business community, the churches, the NGOs, um, the hoteliers, those in entertainment? Have there been a multi-sectoral relationship where you interact, interface, share information um, in an effort to address the problem in a more holistic way?
Yes, there is. As a matter of fact, something that frequently happens is our the health education unit of the Office of the County Medical Officer of Health is always out, always in schools, in churches, in various other community groups, sharing this kind of information. That is a normal thing that we do. As a matter of fact, whenever the season pops up, whatever it is, they really just go dust out the presentations and show that they're up to date and show that we are, we're bright and up with the times, and we run with it because it's something that is done every year. It's a continual process. We have not had, well, at least not for dengue, we have not had any real direct interactions with the private businesses, for example, but we've done that for other activities. We've partnered with private businesses when it came around, carnival time, encouraging them to within their establishments, ensuring that they're practicing safety protocols, the washing of hands, all of those things that are necessary. So those kinds of interactions happen frequently. But as I said before, the single case of dengue that we have, the single confirmed case, we got that information literally last weekend. And so we have been doing proactive, preventative stuff since then. Since that case has come about, the public health individuals have gone in and followed the protocol, and the protocol includes going to the home of the individual, ensuring that the other family members are not exhibiting symptoms, actually spraying in the homes and in the homes close by, to ensure that whatever mosquitoes are around, that those are killed, and then we continue with the normal processes of the preventative stuff throughout the island, which is what we've been doing.
Have you all done any formal audits or informal audits, if I may put it that way, of whether the hospitals, the general hospital in Scarborough and the clinics and so on in the communities have uh, ample supply of prescription drugs if things evolved to the point where there's a more drastic radical outbreak and your citizenry need access to medication? Have you all done that to ensure that before anything presents itself that you're ready?
So the challenge with medications in the public health system in Tobago is that we use the C40 mechanism. So we have to get it from the same source that all of the hospitals and health centers in Trinidad get it through C40. And it's important to note, though, that when we're talking about dengue, there aren't many actual medications for dengue specifically, but what we do is treat the symptoms that people may have. And that's why a part of the education that I've been doing is to identify for individuals or help individuals identify for themselves the difference between the mild symptoms that most people get for dengue and the severe symptoms that they definitely need to get to the health facilities with. Because what we do not want is a situation where everybody who has a headache and body ache shows up at a health facility, because we don't necessarily want to overwhelm the health facility for that. So we have been educating in terms of these are the common symptoms, these are the mild symptoms, the headache, the body ache, the nausea, the rash, the pain in the back of the eyes, and so forth. And if you have those symptoms and they are mild, then you can go ahead and use your paracetamol. You can go ahead and use your regular stuff, the Tylenol and the Panadol and so forth that you usually take for a viral infection, for the symptoms of a viral infected. But what we've been telling people is to ensure that you avoid pain relievers and anti-inflammatory drugs like aspirin and ibuprofen and so forth that are blood thinners or that can promote bleeding. Because if you are one of those individuals with dengue who happen to have some of the more severe symptoms, some of the severe symptoms of dengue include bleeding. And that's why we've been telling the public that if you recognize that you have some of the more severe symptoms, the belly pain, the vomiting continually. So if you are vomiting more than 3-4 times in a day, if you have blood in your stool or blood coming out of your nose, or you have bleeding gums, it means that you are actually having bleeding happening. And therefore, you are the one who needs to get to our hospital, to get to our health centers, because you would need a little bit more care, managed care, than the person who has the simple, mild symptoms. And because we know that we are treating those things, so we are treating the bleeding, we are treating the pain, we are treating the whatever, I think we are in a decent position when it comes to having the drugs for those things. Yes, we continue to get stock out. Up to today, I got a message from a client, from a patient who is telling me we don't have a particular drug, and we need to go and look into that and so forth. And generally on the island, we are looking into the option of going outside of the normal C40 route to get some of these drugs that seem to be more difficult to get. But as it relates to treating dengue specifically, I don't think that we have a challenge with the medications that we need to treat the symptoms that people are popping up with, or people would more likely pop up with on the island.
But clearly, public education drives and programs like this, where we address some of the supply side and the demand side narratives, helps. Um, I think one of the things that we need to be mindful of, there might be a lot of elderly people who are very hesitant to visit medical institutions. They want to engage in home remedies, things that they would have heard and so on. So we tend to want to discourage that sort of thing, because you don't want a situation where the home remedy doesn't work, and then you have to head to the health center now, where things are far gone. It's gone to the point where it's severe.
Yeah.
I would imagine that Tobagonians look after each other. So the persons who are listening out there, if you know that you have, elderly neighbors, that one should try and at least lend an eye, visit them, find out what's happening, see how they're progressing, just in case that they're being a little too cautious and want to self-treat and self-care.
Certainly, that is a critical point and a very, very, very important point. And yes, so we are really asking us to be your neighbor's keeper. It's the same message we used during when Beryl was passing last weekend or the weekend before. So, you know, you are fine, but cast an eye on your neighbor, particularly if you know that your neighbor is a little older, may have a disability or some other vulnerability that would prevent them from being able to do the work, to respond in a particular way. So definitely, and that is why we are pushing it in terms of the difference between the mild symptoms that you may have and the water mode and flower kind of symptoms. And when you have the water mode and flower symptoms, those are the times that you need to call, you need to get to a health facility. The number that we encourage people to call in Tobago to get any kind of emergency care is 211. We have a call center that can route calls to the police, to the hospital, to the fire service, to our emergency management agency. So 211 is the number that we encourage people to call for any and everything on the island, and you could get service that way. But definitely, we also have a situation where, you know, quite a number of our elderly patients, I guess it might be a cultural thing in Tobago too, where they love the idea. They actually look forward to going to the health clinics for their clinic days and so forth, because it's a way to socialize as well. So I am not too fearful about our elderly, at least not the women, staying home and self-medicating when they should be in the hospital or the health center, because they flood to the health facilities to Lyme in some instances.
I guess it's the same everywhere you go. Yeah, I have an aunt, an elderly aunt, who looks forward to clinic day. She made friends there, and she's looking forward to seeing those friends.
Certainly, certainly.
The Tobago has been quite resilient. You mentioned Beryl earlier. You just had to face the threat of Beryl a week and a half ago,
Mhm.
and before that it was the oil spill in Scarborough area. So Tobago has always been that sort of responsive sort of community where the challenges that face Tobago, they deal with it and roll with the punches.
We absolutely have no choice because we are on an island all by ourselves. You know, we have to, you have to get up and you have to face whatever the challenge is, and you have to go back tomorrow and get up tomorrow and put on your big girl pants and your big boy pants and just do what you have to do. It's one of the things that our administration has been very, very proud that we've been able to withstand so many shocks. I mean, it's literally been one thing after the next, after the next, after the next. As a matter of fact, when we came in, when I became Secretary for Health, Wellness and Social Protection, it was literally in the height of COVID where we were having the largest volume of COVID deaths happening on the island. And we were able to withstand that and withstand everything else that's coming up. Let me just answer very quickly because I saw someone in the comments asking for the symptoms. So the common symptoms of dengue are the mild symptoms that you get a headache, body ache, pain behind the eye, nausea, vomiting, or a rash. Those are the common mild symptoms. But if you have the severe symptoms are belly pain, tenderness, vomiting at least 3 times within a day, bleeding from the nose or gum, blood in your vomit, blood in your stool, and extreme tiredness for the person who was asking about the symptoms as relates to dengue. The one with the pain behind the eye, though, may be the most telling because many of the other symptoms are general viral infection type of symptoms. But if you recognize you're getting that pain behind your eye, that is the one thing that is a little bit more on the dengue side than many other viral infections.
So, to your Trinidad neighbors, and I know we are Twin Island state, but we Trinidadians love to run to Tobago when Thursday comes. One
And
of the
we welcome
concerns
you.
one of the concerns is everyone likes to take those little boat trips to No Man's Land, to Birds Island. Um, we walk across the Pirates Bay. Those who
Mhm.
lazy would want to take the boat. Um, what are some of the efforts that are being made in those little niches there in terms of, do you all have any special cleanup exercises there, or any special vigilance in those areas? Because I would imagine that piracy in a Trinidadian's mind might be an area a little off the beaten path. You all have cleanup exercises in that area where personnel go in there and look to see if there's anything in particular that they need to pay special attention to?
So our public health inspectors have actually been visiting quite a number of those, traditional tourist spots on the island, ensuring that they are safe. And safe in the eyes of public health means food, water, vector borne safety. So they have been doing that. We have also at the Tobago House of Assembly level been pulling together a couple teams to work through how we can develop those areas in a way that do not shift from their natural elements, but ensure that whoever visits remains as safe as possible. So ensuring that we have water and that we have toilet facilities and we have those things available. So those we are actually now working through a way to enhance what is available in those areas without shifting too much from their natural look, their natural beauty, and that kind of thing, because we are conscious of those areas being important spots for our tourism product on the island.
Let's talk a little bit about enforcement, but allow me to couch that part of our discussion along these lines. I'm quoting here from the newspaper, the Trinidad Express, an article by Kamari Rodriguez. The Minister of Health stated, and I'm quoting here, uh, Latin America and the Caribbean have reported 9.3 million cases of dengue so far this year, 2024, twice the number of cases reported in 2023. FAHO stated that in 2024, so far, countries in Latin America and the Caribbean have reported more than 9,500 cases of severe dengue and just over 4,500 deaths. So when we look at the regional figures, we've been quite fortunate, and Tobago have been quite fortunate that that sort of narrative hasn't spelled and spiraled into any large number of deaths. I mean, as you said, there's only been one case reported in Tobago. We haven't had any reciprocation to the volume of deaths. Um, when I look at the legislation that we have in place in Trinidad and Tobago, under the Regulation 27 of the Yellow Fever Regulations 1979, there's a clear indication that here that speaks to if breeding grounds for mosquitoes are found on your premises, meaning the civilian premises, this can result in a fine of $3,500 or imprisonment for 6 months. Um, let us say I'm in Bonaccord and I want to make a report because I'm seeing there's an abandoned lot somewhere that no one is particularly paying attention to. Um, who do I call? Do I make a report at the police station? What is the procedure that you all have in place to make reports based on observation, or if you know you have a delinquent neighbor who simply is taking everything for granted?
I actually had somebody who called me today to talk about a delinquent neighbor who's taking things for granted. So, the approach that we have used in Tobago thus far has been one of trying to bring compliance versus being punitive, if I'm honest. And my public health inspectors would actually tell you that that is the approach that they've been using for quite a lot of other things as well. But if you do need to make a call, the Department of Public Health, the number is 639-1433, or you could email public.health@gov.tt, those two entities, or you can do what the person did today, which is message me. A lot of people find my contacts online. I have never changed my telephone number. 4948827, and that is published in newspapers and on my social media and so forth. So you could contact me via any of those and let me know what is the situation. It helps when you send a picture so that we have a sense of what we are coming to see and a proper location and that kind of thing, and we forward that immediately to the public health department, and they come and they do a nice polite visit, and we try our best to do it the positive way versus the punitive way for now.
Well, we live in an age of social media, and public education is important. It's not only the use of mainstream media like we are engaging in today. Um, are there any special social media drives that you all have encouraged or you all are utilizing? Have you all been encouraging the schools to, you know, do their own TikTok advertisements, anything of that sort? Have you all put any incentives out there for persons to create greater public awareness, to increase public education? These sort of things help. I know Tobago sometimes tends to be ahead of Trinidad in some of these areas.
We are actually pulling together an entire plan as it speaks now, specifically for this. But as I said before, our public health department has actually been interacting and having competitions and that kind of stuff. So, for example, last year, no, maybe it was early this year, I can't remember the time period. We actually worked with the preschools on the island to do a hand washing video. So all of these preschools were invited to come and do an actual hand washing video using, the same TikTok model kind of thing. And we judged those and they gave them prizes and so forth based on that. So that is a normal thing that we do. We are currently rolling out the areas pertaining to dengue right now. But those things that you've highlighted are normal things that we've been doing over the years. And it's just a matter of continuing it and continuing it and just shifting the focus as we go through the year.
I want to thank you so much for making yourself available, Madam Secretary. Um, Thank you for your warmth and for your availability. Hopefully, we can have another conversation with you again. It's 6 o'clock. We've spent 40 minutes with you. Time flies when we're having fun.
Certainly. Well, thank you so much for inviting me on. Certainly, I will make myself available as long as it's an issue that we could chat about. Just reach out and I'll be here.
So enjoy the rest of the evening and thank you again for your time. To the listening public, we've been having a conversation with Dr. Faith B. Israel. Thank you so much for your time again. Enjoy your evening and be safe. Thank you. David, we were handing over to you at this time.
Okay, thank you. Thank you,
Public,
as well. And thank you to the other guests we had on the program today for Hard Talk with host Farid Ali.